All right, grab your coffee, grab whatever. Take two after Chance Rush coming to you live again. I got a camera on me. All right. Thank you for coming back from the break. Don't forget to go down to your listening sessions at your appropriate times. I know when you guys have to leave, I understand. Going on for the next 15 minutes, if you're in region 1, 3, and 8, go ahead and head down there to the boardroom with Dr. Robideau over there. 10:35, region 2, you'll be taking off, okay? You guys all having a good time? So far, so good? Look into that stuff, that healthcare stuff. I know we enrolled and re-enrolled and re-enrolled again. So we're going to move right along here. Is Mr. Neumann with us? Okay. Hey, how you doing there? I like that top here. SAMHSA, right? Okay. Ladies and gentlemen, you also should be having your evaluations in your little packet there. Is that correct? Evaluations?
Oh, yes, I'm sorry. It's inside of your NCUIH folder.
NCUIH folder, your evaluations. So,
For each section.
yeah. So, is anyone stressed out this morning from anything? Angela Young, I got you a stress ball just in case. Okay. So, at this time, we'd like to call upon a. All right. Is that okay? Yeah.
No, that's okay. So I just want to make sure because if I had some time, you go off.
Ladies and gentlemen, doing the overview for SAMHSA is our Administration Tribal Training and Technical Assistance Center. He's our Tribal TTA Center representative. Let's hear it for Gary Neumann. Ladies and gentlemen, give him a round of applause as he takes the microphone up here. And don't forget, evaluations are in your NCUIH packets. Mr. Neumann.
Thank you, Chance. Good morning. It's good to be here. I wanted to start out with a question. If you're from Montana, you've probably heard this and you know the answer, so let those that might not have heard this answer. What did the mother buffalo say to her boy when he leaves the house in the morning? Bye, son. Thank you for that courtesy laugh. This is my first, well, actually my second assignment since I came on board with Tribal Tech, the Training and Technical Assistance Center out of SAMHSA. I currently wear a couple of hats. I'm working back on the Flathead Reservation. I moved back home in May from Billings so that I could put together a training for our tribe in Montana, for tribal health, for the providers, for the hospitals, on the Affordable Care Act and what it means for Native Americans. And so I just want to put a little plug in for the Affordable Care Act. What we're finding on our reservation is that people are slow to sign up because they've got tribal health. So they're not thinking it's important, but by educating tribal health employees, staff, personnel, it looks like the training is going to go out to other tribal departments. People are having these aha moments and they're saying, whoa, I need to tell my relations about this back at home. Or you know, grandma is coming in, she's finding out that her children can get health coverage and go anywhere. People have said, yeah, but if they can go anywhere, they don't have to use tribal health, right? And we're going, that's true. But what it's doing is it's causing tribal health to look at how they provide their services and step up their game. So it's just going to make things better. So that's my plug for the Affordable Care Act. Tribal Tech is a Native American 8A organization out of Alexandria, Virginia. They partnered with Kaufman and Associates to go after a grant from SAMHSA to provide training and technical assistance throughout Indian country. You might have heard of Native Aspirations, Youth Violence and Bullying, Suicide Prevention Projects, where 55 tribes are receiving training and technical assistance. You may have heard of the Circles of Care grants. You may have heard of the Tribal Law and Order Act, where tribes are now taking a look at developing tribal action plans around substance abuse and prevention. SAMHSA put all of those together in one grant and said, let's have a training and technical assistance center. Kaufman and Associates and Tribal Tech went after the grant and got the funding. I'm going to give you kind of a brief overview of what the TTA Center does and its resources, and then talk a little bit about one of the community mobilization efforts that communities are able to receive through the Tribal TA Center. It's a SAMHSA-funded project. The Centers of Substance Abuse Prevention, CSAP, and the Center for Mental Health Services, CMS, came together, and in the past, they've been separate centers. And when I was out in DC before, sometimes they didn't even talk to each other. And they're working with the same tribal populations. So they came together and said, let's work together. One of the things they did that was really interesting is the directors of both of those centers switched jobs for 6 months. And it was really eye-opening for each one of those center directors to be able to really for 6 months find out what the other center does and how they can work together. So the center, the TTA Center, was established in 2014. Again, Kaufman and Associates and Tribal Tech. The objectives are to provide culturally appropriate training and technical assistance to Indian country. Now that means something different in each community, and it means something different in the urban centers as well. They've put a large effort into these tribal action plans. Last month there was a tribal action planning TA in Billings, Montana, and my tribe brought me in May under contract for 6 months to help them develop a strategic plan related to substance abuse. It came as a result of last November. There were 11 babies born on the reservation. 9 of them were Native American, and all 11 were meth babies. Unfortunately, it didn't come to the council's attention and get on the radar screen until one of the tribal council members' families had a meth baby. And oftentimes that's how things get on the radar screen, is someone has a tragedy or a crisis. Now, I've worked in this field for about 27 years, and I remember 10 years ago working in California and finding out that the Mexican meth cartel strategically sent Mexicans to tribal communities to get jobs, to marry, to have families, and then the meth was brought in. It was a strategic plan by the Mexican meth cartel. So when I came back to the reservation, I'd been gone about 10 years, and when I came back to live there this last May, I realized it's even stronger now. And the meth, the marijuana, are things that are so much more stronger and so much more potent, and they're taking people down so much faster because they're eating you from the inside out. And one of the things I know is in my reservation in particular, people are hurting. They're hurting economically, they're hurting spiritually, the families are hurting, and one thing I know is that hurt people hurt people. Hurt people hurt people. And when I start conversation with that, people start talking about their hurt and their pain and the crisis that they're in. And one of the things we realized on our reservation is that there are a lot of programs. There's social services, there's tribal health, there's the college, there's a prevention and wellness center, there's all these different things, but they've siloed themselves. They all work with the same individual and the same families, but they're not working together, they're not talking, they're overlapping their services. And about a month ago I asked at a department head meeting, If I'm an alcoholic and I want to go to treatment or I need help, who do I call? The tribal department heads didn't have the answer. So one of the trainings that Tribal Tech can offer communities is community readiness. And it was developed by the Tri-Ethnic Center, and there are 9 stages of readiness, and it's a process where communities or tribes or any program can find out how ready they are to tackle an issue. And then there's interventions related to each one of those steps of readiness so that they can develop an action plan. And after the tribal action planning session in Billings last month, what I realized about the Tribal Law and Order Act was it's not a law that's saying tribes have got to do something. It's a law saying the federal government partners and agencies have to work together to help tribes to develop these action plans. And consultants can come from different communities and work with tribes on developing these tribal action plans. They want to work together with other TTA providers. There are other agencies within the federal government that provide training and technical assistance. And the idea to have a Native American Center is to bring all of those agencies together and say, okay, how can we best use our resources to support your community or to support the training that your tribe may need? There's about 200 consultants that are Native American consultants that are on the roster with the Tribal Technical Assistance Center. One of the things that the center believes in is to send a consultant from that community who knows some of the community norms, who knows someone in the community, who may be introduced in a very respectful way into that community, so that you get a lot more credibility, I think, if you know the community and you're part of the community. So it's not a technical assistance center where everybody's housed in Washington, D.C., and there's 200 consultants with offices and cubicles. It's a very small staff at Kaufman and Associates and Tribal Tech that have offices in Spokane and Washington, D.C. and Virginia. The rest of the work is done by consultants that live out in the field. And I was just hired over a week ago to be one of those consultants to help provide training in TA. And they said, can you go to DC, to NCUIH, and share about the new TA Center? And I said I'd be happy to, because in my past life, I worked for 8 years with the Native American Center for Excellence, providing training in TA specific to prevention and substance abuse. So it made sense that I kind of come back into the fold. There are 3 principles behind the approach. There's a clear vision, that there's circles of relationships, that it's about a handshake, it's about a relationship, it's about communicating, and that we want to depart that there is a sense of hope. Empowering youth to strive for a bright and healthy future. The center is very clear that this is one of the things they need to do. Circles of relationship. Success is about relationships, period. And a sense of hope. Small actions can make a big difference. We all know that. The overview, there's a plan of performance, the training and technical assistance piece, training for government project officers. Now last month, SAMHSA has a number of project officers that are handed Native American portfolios or grantees and say, now you have these tribal communities now, and they just got a suicide prevention grant or a Lee Garrett Smith grant or a Native Aspirations grant or whatever, and you're going to be the project officer. The project officer training is a very important piece so that the project officers that have never worked in Indian country can learn from other project officers and from tribal consultants about how do you work in Indian country? What are some of the things you need to do? Now, one of the first things I said they need to do is they need to If you get a tribal grant, you need to go to the tribal community and introduce yourself and begin to establish that relationship. Well, there isn't funding for that. Some project officers might not get to their grantees for a year or 2 years. So they said, let's do something back in DC where we can educate project officers about working in Indian country, and what are some of the norms, what are some of the rules, what are some of the ways you enter a community, and those kind of things. They've been very receptive to this kind of approach. And now they're looking at inviting in other agencies so that they can learn as well. They're trying to share as much information. There are websites that are being updated constantly about new information that we're finding out about in Indian country. Data collection and analysis, every grant has this, and so does this project. There's an expert panel of experts that have worked in this field for a number of years that come together and meet and help guide the direction of the center. They're the eyes and the ears. They come from the communities. They come back together and say, okay, this is what I'm learning works in this community. How's that working in your community? And maybe we can help guide some training or technical assistance in these areas. Reporting, of course, task 8. I don't know what that is, but they said it doesn't apply, so it says NA. SAMHSA Tribal Tech Advisory Committee. I'll share a little bit about that, the Circles of Care and Native Connections. The training in TA, it's broad TA, it's open to all 566 tribes, tribal programs and herbal programs, and organizations that serve tribes. So all the urban centers, hello?
It's very disrespectful to say herbal instead of urban.
To say what?
Herbal.
Oh, it is. Was I saying herbal? I mean urban. We talk different on the res than they do in Billings, Marge.
We come from the same res, so don't be
True fact. I'm a real flathead. You can see that.
And I've got mine covered.
There you go. And no, you can't have my sweater. They do webinars. It's one of the ways the federal government is looking at providing TA. I'm not really supportive of that, and I probably shouldn't be saying this because it doesn't help provide that relationship building, but it's an effective way the government believes to provide training in Indian country. Now, I've been on a lot of webinars. I don't think it's that effective because when there's webinars, and they're an hour long, and you're sitting in a room with 15 people, and they're watching a computer screen, they're typing, they're doing something else, they've got their Blackberries, they're doing this and they're doing that. They're not paying attention. But that's how one of the ways, one of the mechanisms we've been asked to provide TA. That doesn't help in communities in Northern California where they still have dial-up, and you may not be able to effectively do webinar, but it's a challenge. We're trying to meet that. On-site TA, strategic planning. How many of you are familiar with GONA's, Gathering of Native Americans? Raise your hand. Okay. I'll talk a little bit about how GONA was developed and how programs, tribes, urban centers can access an actual 3 to 5 day GONA training. Some of the other ones are suicide prevention, two-spirit, sensitivity, learning communities, community wellness, training of facilitators, tribal action planning, healing the healers. We need that so often in our communities because people that work in this field are deluged with crisis every day. And we need to take time so that people that work in the field can come together and do some healing themselves so they can go back out and work in the community. The webinars, the tribal action planning webinars, we're going to have one this afternoon at noon to kind of share an update on the tribes that have gotten involved in this process and where they are today so that they can share that information with other tribes that want to be on the webinar to learn about it. And the different learning communities for youth wellness, two-spirited, tribal action plan are being developed as well. Focus TA, specific for SAMHSA grantees. So if you are a SAMHSA grantee or you're working with a SAMHSA grantee, they can access this free training and technical assistance as well. They've done strategic planning, community readiness, working with states and tribes on communication and helping bridge that gap, learning communities. Now the broad and focused TA, the GONA trainings and other training of trainer events. There have been a number of communities that have been trained on the GONA community mobilization process so that they can do that themselves in their communities. Other TA efforts, some of the other tribes and centers that have received TA are listed here. The presentation will be on the NCUIH website if you want it. We've got some handouts back there, a fact sheet, and a little information about it, about how you access TA. If you're requesting TA, you go online, you request, there's a website, you'll be contacted within 48 hours, and the idea is that once you put in that request, steps start happening at the federal level so that this can get approved. Now, we had community readiness come to our community last week, and the TA Center was able to pay for the 2 consultants, for their consultant fees, for their lodging, for their airfare, and for 6 months of follow-up TA they're able to do on the phone or by conference call to make sure the action planning that we did in our community is moving forward. Now, our tribe had to come together and find a location and take care of the meals during the training. So the idea is to leverage resources. They look at the tribes that are asking for TA or the urban centers that are asking and saying, what are some of the things you can provide? Here's what we can provide. They're saying it takes about 3 weeks to get a training or TA request approved and run through the process, but we did it in a week and a half, so I know it can be done quicker. They're providing intensive TAs to 6 to 8 tribal communities that were chosen through basically the Native Aspirations Program that have already been receiving some kind of training in TA. And if you're, let's say the Yurok tribe in California, and they've been working on suicide prevention, they've had a community mobilization effort, they've developed a plan. Their next step is they're going to need community readiness. So the TA Center can bring in consultants to provide them community readiness so they can move to the next level. So they're eligible for additional TA besides the one time. I don't agree in one-shot wonders. You feel good, they're wonderful, but if there isn't follow-up and there isn't an action plan on what you're going to do next and someone to keep you moving down that line, often these efforts just die. The intensive TA, there's a site visit, virtual community readiness assessment that's done, the GONA, and then TA, community prevention planning, sustainable site visits, and then tribal leader meetings. The tribal, it's called the TA tracker. So the information that's put in the TTA tracker about your particular request, you have to identify what's the problem or the need that's going to be addressed through that particular TA, and the purpose and the description of what services you're looking for, and who the target audience is, and the number of participants. So if you're looking to do TA, just be ready to answer those questions up front. Now the center works with a variety of partners on leveraging resources. The Office of Indian Alcohol and Substance Abuse, that's the new office under the Tribal Law and Order Act. Collaborative for the application of prevention technologies, which are the CAPS, which provide training in TA. The SAMHSA regional administrators are partners. Fetal Alcohol Spectrum Disorders Center for Excellence, Indian Health Service, Suicide Prevention Resource Center, Bureau of Indian Education, Addiction Technology Transfer Center, Department of Justice, Circles of Care Evaluation, and Veterans Administration. When a TA is requested, kind of all of these partners are in the loop to see what they might be able to bring to the table to help provide that training or TA. Sometimes this can slow things down by talking to all of these people about things, because everybody is in meetings. I mean, when I went back to SAMHSA, I mean, they had meetings to talk about meetings to talk about meetings. One of the things I liked about living in DC was that I could go to SAMHSA and meet with the project officer that very day and get an answer. That meant a lot. When I was out in Spokane or on the reservation and you want something like that, then it's a 3-hour time difference. You have to set up a meeting. It can take a week before you even get a time to do a meeting. So the benefit of having the TA Center, Kaufman and Associates, and Tribal Tech in DC is they can go directly to SAMHSA and ask questions. The training for the project officers, we talked a bit about that. If you're interested, there's a website, and again, this will be available to you. And if you wanted to be added to the listserv of the webinars and things that are coming up, there's a way to be put on that as well. The expert panel, 12 to 15 members that meet and kind of guide the activities of the center. It kind of reminds me, we had a project years ago on our reservation called the Blue Bay Healing Center, and when we started that project, we went out to elders in the community and we took them a gift because they were sharing their time. And we asked them, if you could pass on 3 things to your grandchildren, what would those be? We collected their responses and we put them together. And I've done this exercise in a lot of different settings. And when I ask people that question, what would they pass on? The things they write down are respect, language, culture, self-esteem, a lot of things. Put them up on the wall and we look at them and I say, if we were a tribal council and we designed our program around those things, I don't believe we'd fail. What we did with the answers that the elders gave us is we designed projects around those. We found people that knew things around those and we started sharing that. The elders came back once a year and gave us an update on what they were hearing in the communities. That's kind of what the expert panel does. They're out in the communities, they hear how things are going, and they come back. And they say, here's what I've heard, here's what you might want to consider focusing on. The SAMHSA Tribal Technical Advisory Committee, the TTAC, that was established in 2002 by executive order, and the committee meets to enhance government-to-government relationships. And the Tribal Tech and Kaufman and Associates facilitate that gathering and get the results of that and plan the next one for the next year. Circles of Care, it's a 3-year infrastructure planning grant. This is the 6th cohort of Circles of Care projects. They're tribes and urban communities, and the center provides training in TA to those. Native Connections, it's a new SAMHSA grant that came under the TTA Center, and it's specifically focused on youth up to the age of 24 and reduce suicidal behavior, reduce the impact of substance abuse, to allow the communities to support youth and young adults as they transition into adulthood. And it's one of the latest entries to the Tribal TTA Center. They're doing a conference this week in Washington, D.C., where they're bringing tribal youth together to put some issues on the table and try and move them forward. That information will come back to this Native Connections TTA Center in hopes to get information out to communities. The GONA was developed several years ago because there were community mobilization efforts that were developed for the African American communities, for the Hispanic communities, and for the non-Native communities, but there was not one specifically for Native American communities. So 16 Native Americans that have been working in the field came together and developed Gathering of Native Americans curriculum. And if you print out the whole curriculum, it's about this thick. It's a 4 to 5 day event in a community. And what it does is each day focuses on a different aspect that is familiar in Indian country around human growth, development, and responsibility. The first one is belonging. What I've learned is that's one of the important steps when an infant is born into this world, that if they don't have a sense of where they belong, they're at risk. Gangs know this. There are other influences out there that know this, that come on board, we're going to make you feel like you belong. If you don't get that sense of belonging at home or in your community, we had one of our tribal elders that his name was Bearhead Swaney, and he would often see youth that he knew, their families, and he would stop them on the road and say, "Get in," his pickup. He would drive them around the reservation and say, "Did you know that your great-grandpa used to live here, or this was their original homestead, or this is where your family had a business at one time, or this is where they lived, or this is where your family used to travel every summer from this community to the next community? Did you know these things?" And oftentimes the youth didn't know it. And it was the first time anyone gave them a sense of belonging to that community. And I believe if you feel like you belong somewhere, you're going to do everything you can to stay there or stay connected in some way. So the first day of Agona is all around belonging. How everyone in this room belongs here. People are here for a reason, and everyone belongs here. That's what the first day is. It deals with rituals. It deals with ceremony. The communities bring their rituals and ceremonies to the 4-day Gonas. It takes about 6 months to really plan one, but they're very, very effective. The second level is mastery, and that's the adolescent stage, where adolescents are trying new things, and they're going to try to do something, and they're going to explore, and they're going to experiment, and they're going to do this, and they're going to do that, to see what it is that they're actually good at and what it is that they master. So when a group of people feel like they belong to an effort, put aside, "You dated my cousin 20 years ago and I'm still angry at you for that," or "Your sister, da-da-da-da-da." Thank you. He could hear it. We set that aside during Agona. We're not there to fix it or solve it. We're going to set it aside so we can focus on whatever the effort is that we're trying to come together with a plan at the end of this 4 days. Once people have figured out what it is they master in a community towards an effort, and they feel like they all belong to this effort, the next stage is interdependence. So now let's come back to the table where you bring what you are good at, and you take this part of the effort. You bring what you're good at, and you take this part. So that one person doesn't have to do it alone. That everybody brings what they are skilled at to the table. And then the final, 4th day, is about generosity. It's about, now that you've done this and you've reached an age of wisdom or elder, it's time to give back. It's time to pass on what you learned. I believe in our communities we need mentors, we need role models. We need to have youth by our side at all the things that we do so that we can pass on what we've learned to them in a very good way. They're not going to just automatically get it just because we say they will. We need to mentor them. They're looking at tribal youth councils again, which I think is a great idea. And it's giving your knowledge, sharing, giving back to the community. So those are the 4 days that you work on during Agona, and you come out of it with an action plan, and everybody's been involved. It's opened in a good way, and it's closed in a good way. Whatever works for the community. The community elders or the cultural components of that community help plan it and they're there to participate. I'd like to say that when GONAs happen in communities, all the tribal councils show up, but that doesn't necessarily happen. But when you are participating in a GONA and there's 1, 2, or 3 tribal councilmen from your community that stay for the whole 4 days, that really gives a lot of strength and support to the people that are there. They believe, the leaders believe this is important. So communities can ask for these GONAs to be planned in their communities to deal with community mobilization. If you're interested in making a TA request, here's the link. Again, there's some information outside on the table, the resource table, where this link is. Now, I'm done. Are there questions or comments? Or I don't dance, I don't sing, so that ain't gonna happen. Have any of you had training or technical assistance in the past from one of the SAMHSA TA programs? Was it a good experience?
Yeah, it was great.
Can you share a little bit about what it was for?
Well, we were a Circles of Care community, and we just started the Systems of Care project. So we did the Circles of Care evaluation during the 3 years, and then we did the GONA training of facilitators 3 times. And our community has really shared that they want to continue having that GONA training of facilitators every year.
Yeah.
So we're doing that. This year, 2015 will be our 4th year having GONA in our community, and we started out, I think 2012 was our first GONA, and we had 44 youth. And then the next year we had 56 youth, and then the last we had 70. So it's grown a lot, and we're a relatively small program, so the only way we were able to grow that much was we were able to grow that much is that the volunteerism from the community and people wanting to help out grew along with the number of youth that wanted to participate. And then the last, we always have it in July. So last July, when we had 70 kids, that was more than we expected, but we were really excited because we had kids from all of the local rancherias that were around us, and plus kids that lived in the city. So it was really good to get them all together. But the training is really great. We've had different facilitators do the training, and it's been great every time.
The different facilitators bring different elements to it that it can grow. I participated one in Hoopa in Northern California, and they paired it with the final day. We floated down the river. All 60-some people that participated floated down the river to the original spot where the tribal ancestors had landed and had a ceremony there. And one of the other ones was in South Dakota at Crow Creek, where we had people in 3 different communities doing GONAs, and then we all came together the last day to welcome back the riders that had taken the ride to Minnesota where the Native Americans were hung, and welcome them back. And it really helps mobilize a community around whatever effort that you're looking at doing. So I believe in them. I also believe that they have to happen more than once, that there has to be follow-up, that people get engaged and they get excited about it. If they know it's coming the next year, it even gets bigger. Yeah.
Hey, Don.
Hi.
And first, thank Izzy for all her work in getting you here. I can attest to the fact that it takes about a week to get through the webpage. But I have a few questions, and the reason that we wanted SAMHSA is because honestly it's been very difficult for urban Indian programs to get funding. Not that you haven't funded urban Indian health programs, but we're really here to find out what we need to do and what are some of the components of ingraining ourselves in SAMHSA. So on the expert panel, you have federal, tribal, national, and private representatives. And in there, is there an urban Indian representative on that panel?
I don't have the answer for that.
Okay.
I think I came from NACE, which was the Native American Center for Excellence that was kind of like the grandfather of this.
Right.
And we did have urban representation there. So I want to say yes, but I'm not sure.
So is anybody in the room? Do you know if you sit on that? So if we could look at that further, I mean, just explore that.
It's important.
Yeah. And then the Native Connections, and that's the youth up to 24. And are there any urban dollars or any urban programs that have received any kind of funding through that program?
There are some. They sent me the list.
Okay.
Just so that I'd have an idea of what they were, and I know there are some.
Okay.
I don't have the email with me, but I got it just before I came up here.
Okay. So I think if those programs, if you're a program that's getting that type of funding, that if you're a program and you're here and you're getting that, I think it's really critical that you start to share with the other urban programs. I think there were 6 or 7 urban Indian programs that wrote for the Circles of Care. And we're also concerned about the panel of reviewers. We know that there's recommendations made out of the project officer out of SAMHSA, but that's just a recommendation. And I know that SAMHSA is pretty limited in once it leaves that recommendation. But I think we do need to explore the knowledge base of those reviewers understanding urban Indian health programs and how we fit into the ITU part.
Don't give up on that. Keep asking that question. Keep demanding that there be. I mean, we took years before we got Native American reviewers to review grant programs. SAMHSA's always asking for recommendations, and keep pushing it, keep asking, keep putting those names forward. And if the TTNA Center can help in any way, let us know that you've made these recommendations, because we can have that discussion with them.
Okay. And then, sorry, and then my last is, in the exploration of the Circles of Care grant, we suddenly felt like GONA was a great opportunity. We had not heard of it at all before we started exploring that. And we had started asking about the trainers, and they're extremely expensive to bring in. You cannot do this without some probably outside funding source because of the cost. So is there a training that would be available for cultural individuals in our urban programs to attend a GONA training that we could then share among our sister programs in the urban arena and maybe have that at a less expensive cost to the programs?
One of the pieces of the GONA is that they brought together I think it was 14 communities where they did a training of trainers so that people in communities could be trained. And I know there's probably 60 around the nation that have been trained in doing GONAs, and they're available, and they're consultants for the Tribal Tech Native American Center, and they can be accessed, and their consultant fee. I mean, I do know that if you look outside of SAMHSA and you want to bring in a GONA trainer, not through SAMHSA, they are expensive. They're about $1,500 a day, and we can't afford that. So what we've done is we've asked them to become consultants and have the TA requests through us so that they take a lesser consultant fee. We give them maybe more TA days so it helps out there. But it is about giving back. It is about, if you've learned something, one of the elements of GONA is that you need to give back and not charge for giving back. So what I'm hearing is maybe do a training of trainers for some of the urbans so that there will be a group of people trained from NCUIH, for example, on doing GONAs, so you don't have to access these. I'll put that forward.
And I think NCUIH could be a great facilitator of that, because when we were searching, I don't think we found anybody that would, well, okay, maybe because you're going to South Dakota, so I totally get that. But we couldn't find anybody less than $2,000 a day. And that was, and we liked it so much, we wanted to try it even without getting the circles of care, but we just cannot afford that as an outlay, you know, initially. So
Yeah.
thank you very much.
Yeah, we don't have the dollars in our communities to do that. And I've worked with some Native American consultants that have kind of crossed over the bridge, so to speak, and are really charging that. And I believe their time is valuable, but I also believe when you come home, like I did to the Flathead Reservation in May, that these tribes, these programs can't afford it. So we need to figure out how we can do it where it meets everybody's needs. And you're right, it takes a while to get one planned. But the idea is that maybe the TA center will pay for the consultants and their travel and their lodging, and the community will do a space, or they will do the food or something like that. Yeah. Any other questions? Yes, sir.
Yeah, this is my first time I heard about this Gona, but you know, it always goes back to the almighty dollar. You know, why have all this? Why have all these programs? Why you have to pay through the nose? And so, and same thing like today, health food, it's expensive. But then at the same time, you know, it makes you think. It's like in Indian country, like if you lose weight, our elders say, hey, what's wrong with you? Are you sick? You know, that's our typical, how we know each other on the res, you know. So all this, I always look past that. Somewhere there's always a door open, especially being connected, because they always, the way the tradition is, as long as you know where you come from and who you are, and everything else will line up. So, you know, I'm glad that this is brought out over here. So some way or somehow the funding will happen. And it's just like you're thinking, however, whoever these people put it together, it didn't stop there. So even though there's no funding, there's going to be a way. There's going to be a way. Because at one time, my ancestors weren't supposed to be here at one time, you know. But look, we're still here. And then just listening to all what's going on here, the funding, just like how the treaties were from the beginning. The treaties said, the government said they were going to give us health care. But then they got all these between the lines funding, can't get this, can't get that. But yet we're still going forward, yet things are still happening, and jobs are being provided for people. So I see that. So somewhere, somehow, it always makes a way. And then Creator, you know, He makes that happen. And that's why He gave us this brain. We're supposed to use it, you know. And at the same time, He gave us wisdom, but He didn't tell us where it's at. We have to find it. So I just wanted to comment on everybody, you know, what you're talking about here. To me, I acknowledge it. And just like with my individual life, that's what I do. You know, I don't want diabetes. I don't want to get cancer. So I'm not going to wait till something happens. So I think before I consume something. I never did that before, so it's really new to me. So I just really appreciate being here, and especially all the young people that's helping out. And you could be elsewhere, but you're here. So I just want to say thank you.
Thank you.
I think we have time for one more. This young lady right here. You want to?
Thank you. Paulette Bocall, Turtle Mountain, Chippewa, and Executive Director, Native American Lifelines. I want to also just tag on to what Donna was saying about receiving the information about who the reviewers are. I think it's important so we know who the experts are that are representing the grants, and also I would like to know what are the best practices that you've learned from these grants throughout the years. It's your 6th cycle, is that what you said, for a Circle of Care? And also, is there a way to find out who the awardees are for this last round so we can find out if there's a way for us to partner? There may not be a lot of funding, but maybe there are opportunities for us to partner.
I'll ask that they put the list of grantees up on the website.
All right. Let's give Mr. Neumann a round of applause. We appreciate that, sir. I just came in from Washington, D.C. at the Gaylord National yesterday. SAMHSA had their Native Youth Conference, and a big emphasis on it was health, you know, and really pushing it. So it's pretty neat to go out. I don't know if you've ever been to the Gaylord National, but SAMHSA put it on, and it was just amazing. Like, you walked in there, and it was like you were in a movie already. So I felt like I was in Home Alone for a second. Also, I don't know the ties with Kaufman and Associates, but I do know that I'm about to sign up for something to be on a list of GONA trainers. And I know we did one in Alabama, Coshawty. So Donna, if that's, I didn't know if that was the right alleyway that if they wanted to get in touch with them, because I do know that Joanne, I did a training in Alabama, Coshawty, and obviously, you know, as a GONA trainer, you know, that was real big for me too, is I didn't want to have to charge to, you know, GONAs is what we're all supposed to be doing anyway. So,
and if you are a consultant, either with Kaufman and Associates or Tribal Tech, they're partners.
Yeah, and they're out of Albuquerque, right? Tribal Tech, was that?
Alexandria, Virginia.
Okay.
Yeah.
I was way off. Albuquerque, Alexandria.
But that's, if you're interested in becoming a consultant for Tribal Tech and Kaufman and Associates, please contact us, because we're looking for consultants all the time to do things in communities.
Yeah.
And the government rate is $500 a day. And we've had some consultants that have tried to get that increased, but I'm just grateful that at least there's that.
Yeah.
You know,
yeah.
And communities don't have to pay for that. This grant, the Tribal Native American Technical Center, pays for those kinds of things.
Yeah. And that's who it was. It was in partnership with Kaufman and Tribal Tech that we did the Alabama Coshawty event. And they pay you about 45 days later, but it's cool. No, I'm just joking.
They pay you.
Yeah, they pay us. That's true.
Well, we're looking at doing things differently, too, because one of the things with the previous TA Center was a Service to Science Academy, where there were preventions that were happening in Indian country that needed to come together and share lessons that they've learned, and there was $30,000 that they could get to enhance their evaluation component. And so communities were selected. We brought people in. We were in Phoenix, and the first day we were there, we noticed that when it was time for lunch, there were a couple people from the community that weren't going to lunch. And when we asked, one of the things that we had neglected to think about was, if your lodging's paid for, if your airfare's paid for, that's great. But a lot of our Indian programs and Indian relatives don't have the dollars to come to the training for their per diem to eat. They were too proud to say, I don't have any money. So we changed that. So when we bring programs like that together, they get money the day they get there, so that they're not embarrassed. So we're trying to learn as well.
Yeah. And in saying that, on your per diem, don't spend all your per diem in one day. There's a mall right across the street. You don't need that blouse. You need to eat. No, I'm joking. Okay,
thanks.
Round of applause, Mr. Neumann. Thank you very much. SAMHSA. Coming up here next, ladies and gentlemen, we have Dr. Kimberly Flower, being accompanied by the MSPI coordinator, Whitney Hewlett, the Meth and Suicide Prevention Initiative 101. I'm going to give Ms. Flower here is the director of